A live look in Kyiv, Ukraine, where it's 4 in the afternoon. The UN says more than 7,000 people have been hurt since the war with Russia began. Dozens of hospitals either destroyed or damaged, causing a huge strain on Ukraine's healthcare system. Good morning. It's Friday, August 5th. I'm Jill Chadwick in for Jessica Lovell. Thanks for joining us on Facebook, YouTube, and Twitter. We are coming to you from the Dolph C. Simons Jr. Family Broadcast Studio. A lot of us want to help people in Ukraine and avoid getting scammed. We're going to learn this morning how to spot trouble. Plus, Dr. Dana Hawkinson has our COVID-19 count this morning. We know that you have questions. Our experts have answers. Send them to us in the chat thread or the email. The links are on your screen. The images, they are hard to look at. Thousands of people suffering burns and broken bones as the war in Ukraine rolls into its 6th month. Representatives from Global Care Force here at home are helping to provide badly needed medical equipment abroad. The founder and executive chairman of Global Care Force right here in Kansas City, Dr. Gary Morse, he joins us this morning, and with him is Dr. Jim Petty, orthopedic surgeon, and also our guest this morning is Dr. Maxim Pristupuk, a doctor in Ukraine, and they are all joining us now from about 125 miles southeast of Ukraine, or of Kyiv rather. Dr. Morse, if I have my directions correct.
Right. Cherkasy, Ukraine.
And our audience, I think, probably remembers you best from during the peak of the pandemic when you were a guest on behalf of the COVID Care Force. That has now become the Global Care Force. How did that evolve?
Well, when COVID started, we knew, and we hoped at least, that there would be a day when COVID would come to an end. Well, we know it's probably not going to end, but at least it'll reach more of a maybe like flu or influenza, something that's more endemic. But we knew the focus would move beyond that to other needs around the world, not just COVID needs. And so from the very beginning, we envisioned transitioning to Global Care Force and set that up at the same time as a not-for-profit.
I suppose in many ways, COVID kind of pales in comparison to what you're experiencing right now. And this is your second trip to Ukraine this summer. We've seen the pictures and the video, but tell us from your perspective, what is it like there?
Well, there's no doubt that Ukraine the entire country is on a war footing. And this is my second time, and I'm already getting kind of accustomed to it. I mean, that's sad to say, but it's after you see so much destruction and so many sandbags and so many checkpoints and everything that the people are living through, you kind of get numb to it. In Kyiv, where Dr. Maxim is right now, They still have missiles. I understand just a few days ago or a week ago, there were missile attacks again in Kyiv. And of course, in Cherkasy, at one of the hospitals we're working in here, we're working with 3 hospitals or 4 hospitals now. We added one today. But there were missile strikes within a quarter or a half mile of the hospital. The just ceilings crumbled and just the shock waves alone damaged the hospital. So it is a war situation. It's a combat zone. And we are just so proud of the doctors and nurses who are working so hard, doing so much with so little. It's amazing.
That it just sounds like it's terrible, terrible conditions to be working under and terrifying at the same time. Dr. Maxine, since March, the Global Care Force has been helping them with the medical efforts there. But are they keeping up? I mean, earlier before we began the program, you received 90 patients in one day?
Yes. Hello, everybody. I want to say thank you to Global Care Force and Dr. Mosh, because we contact with him and he provide medical treatment and medicine for our patients. Because our hospital, we treat not only militaries, we treat and civilian patient. When beginning the war, it's be a lot the patient, and the war front line be in the Kyiv city, and it's be terrible. But a lot of people from Kiev go to more safety place, but sometimes some days we got the maximum, and it's like at near of the 2 hours 150 patient. It was terrible, but it's working in this situation, and we, when was occupied Kiev region, we living in our hospital and provide medical help to our patient 24 hours each
I want
day.
you to, the front line now is where you are. It's moving. What kind of injuries are you seeing that are coming in, Dr. Maxine?
Oh, we see different and terrible injuries. We saw this a lot the mine blowing injuries. This is shooting injuries. We see the crush syndromes. It was a lot of patients with this different trauma, because usually in our country, it's shooting weapons. It's not legal. And usually in our practice, normal doctor, it's not working with gun shooting wounds and with this problem. And now we start working with this patient, and it's a lot of this patient. Thank you for our friend from the European country, from the US. We contact with them, and this provide for us help and provide to us not only equipment, help provide for us some knowledges how doing in these cases.
I don't suppose that you have an infinite number of beds. So where do all these people go, and how long are they staying?
Thank you very much, but our hospital is huge. We got the 635 place. We got the 3 reanimation department. And before the war, our hospital was, we provide help to COVID patients. And our organization help to provide help to the patient. It's very good. And usually all the patients stay in our hospital. We got enough free places to the patients. But when begins the war, all the not immediately operation we stopped. And usually a patient who does not need immediately help go to home and treat by home. We provide some medicine, but usually we stay in the hospital only patients who need operation or they got the very acute situation.
All right, very good. Speaking of operations, Dr. Morsch, I was wondering if we could ask Dr. Jim Petty about some of the surgeries that he is performing and the injuries that he is working on. Good morning, Dr. Petty.
Hi, how are you today?
I am fine.
Great.
Where are you from?
Well, I'm actually from Southern Kentucky, a little town called Russell Springs, Kentucky.
I have to ask this. You know, I've got a Midwestern accent, you've got a Southern accent. In an emergency situation that you're working under, does that provide any kind of problem or added worry to the work you're trying to do, just trying to communicate?
Well, first, let me clarify. This is also my second trip to Ukraine, and our first visit here was basically meeting with surgeons like Dr. Maxime, delivering medical supplies, and this second trip, we're still in a hospital assessment phase. I will actually begin working next Tuesday with some of the local my orthopedic colleagues here. So although I've been on rounds with Dr. Maxime and we've toured many hospitals and seen them at work, discussed their problems, my actual contribution as far as surgical cases and interchange won't begin till next Tuesday.
I understand that these injuries, if you're shot or a victim of an explosion, these are pretty serious and catastrophic injuries. Talk to us about that. How you
Certainly.
triage.
Well, that's a great question. The first thing I think for most folks to understand is that getting shot by a high-powered military rifle is not like you see in the movies. It's not just a flesh wound where you put your hand on your wounded shoulder and you keep firing your weapon. It is a devastating injury that creates not only a bullet hole, but it creates a large zone of shock through the muscle, through the chest tissue that bruises lung tissue, tears tissue, and it's a quite devastating wound. Now, also, as Dr. Maxime can attest to, you will get penetrating trauma from what we call shrapnel. An explosive goes off. If it goes off near you, the first thing that you encounter is an overpressurization from the blast effect itself. And it literally is like getting hit with a baseball bat. It's a solid wall of compressed air coming at you. Following that, you may have debris, shrapnel injuries, which can actually be like a penetrating bullet wound, or they can lacerate and actually remove tissue. So I'm a former military surgeon of about 20 years in the Air Force, and there's a vast difference in the civilian injuries we see, such as motorcycle accidents, where, say, for example, you have a motorcycle that impacts a car or a guardrail. In that particular situation, it's a high energy, but you're not usually missing pieces of tissue. In a wartime zone, it's a high energy, and oftentimes you have to deal with tissue that has been removed by the explosion. If someone falls off a ladder in the United States, you may have a broken bone that is a clean wound. The skin is not broken. Essentially, all wartime injuries are contaminated. And so Dr. Maxime and my Ukrainian colleagues have to deal with markedly contaminated wounds with extensive tissue destruction, and we're, to put it mildly, all the tissue may not be there. There may be pieces that are missing.
Thank you very much for that answer. Dr. Morsch, I'm going to be asking you about medical supplies and where you get them next. But first, I would like to go back to Dr. Maxim, because Ivan has a question, one of our viewers. He wants to know, what is it like having surgeons and doctors from abroad come over and help you? Does everyone practice medicine the same?
Yes, the medicine practice it's the same, but I'm working usually with the patient with a different type of the wounds and to treatment the chronic and acute wounds of the patient. And for me, when we still see this trauma, it was not very stringent and provide medical help, but a lot the surgeon is beginning to start the provide and medical help to this patient. We also not only patient got the some type of the trauma. A lot of the patient we got the now is the pneumonia, and not COVID infection is not. Disappear anywhere. It's still in our country, and we got this patient, and our internal medicine doctor and infectionist still provides this help because some soldiers got the infection pneumonia in our hospital. We treat this patient.
That is a very good segue to our infectious diseases specialist who now is in the studio. He is also our medical director of infection prevention and control. We're going to break from over in Ukraine for just a moment to talk about our COVID numbers here. Good morning.
Yeah, hi. COVID numbers, staying in the high 20s right now, 28 active infections with 4 in the ICU, 1 on the ventilator, still 21 in that recovery period. But Jill, again, I think we have really seen some plateaus for cases that are accounted for, but also kind of still a slight increase in hospitalizations, over this past week. Hopefully, the overall cases and the circulation of the virus is going to decrease, and that way, hospitalizations will end up following that as well.
I wanted to ask you about a new study that finds that COVID can rebound in people that haven't even taken Paxlovid. What do we need to know about that?
Yeah, we know this can happen with other viral infections, these symptoms. We know it happened before Paxlovid. I think it's important to understand what should you do. You should go back into isolation for a little bit, about that 5 days again, restart that isolation if you are having that rebound. It was never too much of a big deal. It really wasn't talked about too much until obviously the Paxlovid. But overall, again, even with rebound with Paxlovid or this, we haven't seen any further severe disease or death because of that.
We've been talking to some of our people here at the hospital that have tested positive, and they talk about this kind of a little bit of a roller coaster that you go with that. So that's sort of normal. Have a lot of headaches one day and body aches, feel a little better, and then kind of, digress again. Is that normal?
Well, I think we have to, is it normal? Certainly you can have different symptoms. You can have that recurrence of those symptoms there, whatever they might be. You are able to test again if you want to test with that antigen test. However, again, having seen those symptoms again, probably need to go back into isolation, follow those CDC recommendations.
All right, so many unvaccinated first responders are saying that they distrust vaccine, and that's according to a new study.
Yeah, I think there's a lot in that. Again, just distrust of the vaccine. Is it distrust because you believe that there's harmful things in there? Are you distrusting the medical establishment? Are you distrusting the government because they are endorsing it? I think we have proven, and the vast majority of the data would continue to support the fact that with vaccines, you have reduced risk of side effects, you have reduced risk of hospitalization, severe disease and death, reduced risk of long COVID as well. So it's quite important. We know that a lot of these first responders are young people. We know that things like long COVID or even the complications of COVID can be quite significant, even for young people, can quite significantly affect their quality of life. So, vaccines, especially for COVID now, have been around for a couple of years. I think it's important to understand that they are safe, but it certainly is concerning. And then again, what about future issues with vaccines or new illnesses that may come up? Obviously, we have monkeypox going on right now. vaccines available for that. I think it's just important for people to understand that vaccines work. They are efficacious. They are safe. And so it is quite important for you and your children, for the quality of life, to keep you safe, to really utilize those vaccines and get them into the arms.
Okay, and our last headline that we have this morning is no surprise. The study finds that consumers' efforts to quit smoking during the pandemic declined. I'm going to guess that's not surprising to you, but is it concerning?
Yeah, I'm sure there's there have been more people that started smoking as well. Certainly it's concerning for overall individual health, but also community and population health, when we've just had several episodes on about cancer screening and things of that nature. We know smoking can increase your cancer risk, again, can just lead to overall decreases in life. So it's certainly a concerning issue, number one, for that individual, but also for our community.
All right, we have a couple of community questions, but I want to know first, any reporters on the line today? All right, got time for a community question or two. Yin Lang wants to know if well, my phone is failing me. Hold on one second. Okay. Yin Lang wants to know, as more and more people are taking their masks off and the number of flu cases are also increasing in the U.S., do you worry about flu cases going up? And he says, what should we do? I would say, put the mask back on, right?
Yeah. I mean, we saw 2 waves of influenza this year, with the winter and then that earlier mid-spring time. Certainly, influenza cases, last that I checked, were certainly down, but we know we are now going to be working our way into that fall season. I think we certainly, based on last year as opposed to the previous year when everybody was masking and flu cases were extremely low, I think we can expect to see more transmission of influenza, but also those other respiratory viruses. Again, masks are not mandated. We would certainly encourage them, understand your risk of disease, and we know that masks, even for that wearer, even if you are in areas where other people aren't wearing masks, can offer protection against infection.
All right, we have a question for the folks back over in Cherkasy. I want to go to Dr. Morsch. Cindy is wanting to know, does Global Care Force or the doctors there in Cherkasy, are they offering COVID vaccine? Is that even a worry right now? Are they still trying to keep people vaccinated?
Well, certainly they are, and COVID is still present and a concern, even though it's not the high priority it once was. But vaccines are still being given and encouraged. Many countries outside the United States actually have a higher vaccination rate than the United States. For some reason, we've entered this era of skepticism, vaccine skepticism, et cetera. As Dr. Hawkinson said, perhaps it's questioning medical science, maybe it's a skepticism of the government. But in Ukraine, I would say that the people, from my opinion, my observation, are very unified. They do what the government encourages or asks them to do. For instance, when we arrived into the train station, and Dr. Maxime knows this because he lives in Kyiv, the capital city, although we're outside of it, but they have a curfew every night. And people are very careful to follow the rules and to make sure they're off the roads by the time of the curfew. And if you are having to break it, let's just say our train arrives late, you better have proof that you were on that train or proof of why you are out after curfew. Otherwise, you're going to be in trouble. So it's a different attitude here. And honestly, it's refreshing to see people supporting their president, supporting their government, supporting their public health people, supporting doctors like Dr. Maxime, and following the guidelines.
Patrick has a question for Dr. Maxine. He wants to know that with the infrastructure, the way that it looks, and the fear maybe of traveling, people that are not war injured but just need to talk to their doctor, do you have telemedicine? And does it is that a factor? Is it a help?
Thank you for your questions. In Ukraine, our government it's provide to help to each patient, to each people in our country. And this situation, if these people doesn't get any injury, we got the psychological center, special psychological center, like rehabilitation, psychological rehabilitation in each big city where we come and pay people from place where we got the war. And for these people, we provide psychological help and provide also some medical help to each patient who needs some, like diabetics, who needs the insulins. In each region, we provide, and government maximally provide this medicine to this type of patient, or can be cardiovascular disease. We provide the medicine. It's basic medicine, but government or try to provide. And thank you for our friend for the U.S. and European country what's provide to help for us for Ukrainian this medicine, because it's now it's a big program with logistic. And thank you from our country to your help. Thank you.
We're going to try to get you some more this morning, too. And in a bit, we'll list some of the things that you might need. And I will be watching for questions, too. So if you have more of them, go ahead and send them in. Global Care Force is not the only organization helping an already burdened healthcare system in Ukraine. Members of the International Committee of the Red Cross helped transport 10 patients to other hospitals in Ukraine recently to get the care that they needed, despite continued fighting. One grateful patient described the danger.
Most people started dropping onto the ground. My daughter and granddaughters also lay down onto the ground. When the explosions were over, I saw my granddaughters raise their heads, and they started shouting to me, "Granny, Mommy is not raising her head." I wanted to come up, but it turned out that I had a blast wound on my leg. I rose and immediately fell down.
It's just so hard to listen to and to watch. For those of us just joining, we are talking live with doctors in Ukraine where the war is ongoing. We know a lot of you want to help out. We have a link for you. You can see it in the upper left corner, bit.ly/MMU Ukraine. Dr. Gary Morsch is founder and executive chairman of Global Care Force, and with him is Dr. Maxine, a doctor in Ukraine. And we also have Dr. Jim Petty, an orthopedic surgeon from Kentucky, that is joining us this morning. Dr. Maxine, we understand the medical equipment hospital needs include negative pressure wound therapy systems. Explain to us what those are and how they are used.
Okay, thank you very much for these questions. Because I'm not only a doctor, I'm a scientificist. I'm got some scientific work about a negative pressure wound machine. And with this machine, it's more faster to treatment the patient with the chronic and acute wounds. It's helped to us when we making the reconstruction surgery. When I provide investigation, when we put the VAC machine in the chronic infected wounds, after 4 days, in the wounds beginning grow up new vessels. This is show to us the beginning granulation, and we could make in the reconstruction surgery. It's remove pus and exudate. When it's a lot of exudate after some bullet wounds, after some mine wounds. This is help to patient, help to us, and it's not so many days patient must stay in the hospital. It's more faster we can treat the patient and start treat another patient. Because without this VAC machine, it's very difficult working. I remember when I start practice, I probably in our hospital, I'm the first who start using these machines. But in our hospital, we not buy this machine and not provide. And before help of Dr. Morsh, usually patient must rent this machine and equipment. Price is near of the from $200 per week at treatment with this machine. But in Ukrainian patients is very difficult, because usually the minimum salary is near of the $100 per the month, and this is help need to some old patient. It's very necessary and very need to our patient. And thank you for your help for us. And we treat all soldiers who need this, all civilian people who come to our hospital. We provide and treatment with this negative pressure wound vac machine. This is one of the this gold standard of treatment of chronic and acute wounds.
Yes, one more question for you before I move on to Dr. Morsh for a minute. The U.S. Defense Secretary approved treatment of wounded Ukrainian soldiers at the U.S. military hospital in Germany. Is this helpful, and how helpful is it?
Thank you. About your questions, I know that a lot civilian patient and a lot military patients we provide and send to European hospital and provide to them medical help. I know some guys with spinal trauma and young guys with high amputation of the leg, like we sent to European country to secondary rehabilitation and secondary operation, secondary treatment. But now I don't know in each hospital sends this patient. But I know that a lot patient treat in European countries, and I know when beginning the war, our government working with the European government and all child with oncological diseases was sent to treatment in European country.
Dr. Morsh, you're over there, boots on the ground with other doctors, but you are also working hard to get these medical supplies. How do you help them find a negative pressure wound therapy system? That sounds just monumental to try to provide.
Well, it's a lot of work, no doubt, and it's not like there are a lot of companies out there willing to offer these. They're very difficult to find, even for the Ukrainian government and the hospitals. They're not as available for sale as they used to be because there's such a high demand for them. But we have got them donated. There are, I don't know if there are maybe 10 or 20 companies in the United States that manufacture these, and other countries manufacture them. And so we're contacting them. Some have been willing to donate them, but others we have negotiated prices to buy them at discount prices. A full set in the United States for the machine and the dressings, the very specialized dressings, and then the canisters that collect all the pus and the exudate and all that, can run up to $4,000 per unit. So per treatment, per patient. So it's very expensive in the United States. We are getting discounts, but and raising funds and purchasing these, as well as asking for more donations of them.
Well, let's talk about donations and other things that you need. Give us the list.
Now, are you asking me, Jill?
Yes,
or is there
yes. Dr. Morsh,
okay.
what are you being told that they need? What are you being asked to provide?
Well, shockingly, we visited, as you know, we're 8 hours ahead, so it's 4:30. And by the way, Jill, we have, and Dr. Hawkinson, we still have one more hospital that's expecting us this afternoon. So we may sign off here in 5 or 10 minutes and let the rest of the folks finish things out. And I think our CEO is there. Perhaps he can answer any questions. But today we visited a burn unit in one of the hospitals that we've been working with. And we talked to the chief plastic surgeon who's involved in skin grafts and all of that for the burn patients. And he said, not only do we need the wound vacuum systems, but he goes, we also need even the most basic things: forceps, hemostats, needle holders, scissors. In fact, the first thing out of his mouth was, what we need perhaps more than just about anything is scissors, because they become very dull after you use them, even if they can be sterilized and reused like we typically do. So even the basics are in short supply. In some hospitals, we visited a hospital today, a district hospital, and Dr. Maxime would understand how the different, the designation of these hospitals, from a regional hospital to a district hospital, then there's city hospitals. But we visited a district hospital that had no wound vacuum systems. We brought the very first ones to them that they've had. So they're doing everything they can with very limited resources, and they're so thankful to not only Americans in the United States, but all the organizations, all the countries that are supporting them. In fact, I'll just say this. We were at a children's refugee center, and actually we're at another one right now in an office. And they showed us a picture that one of the artists had drawn, and it showed 4 presidents of 4 countries as knights, with holding a sword like King Arthur's knights, with the Ukrainian flag around them. And the presidents were the presidents of the United States, of Britain, what was the other one? Of Poland, and of Latvia. The four countries that have been most helpful to Ukraine through this crisis. So I encourage people that are listening to this or that might see this message to continue to be generous in donating to organizations like Global Care Force, volunteering like Dr. Petty is doing to come over and actually serve, and of course continue to pray and support for the Ukrainian people.
One more question for you, Dr. Morsch, and then we'll get final thought from you, and we'll get a final thought from Dr. Petty. You're going to expand humanitarian aid next month. How are you going to do that?
Well, in addition to Dr. Petty being our pilot surgical team, we want to recruit and send surgical teams. That's orthopedists, plastic surgeons, urologists, specialties of all surgical types to treat combat wounds. We're also organizing our first primary care medical team. Primary care would be more general practice or family practice. This will be a mobile team that will be visiting various villages that have had massive destruction and loss of medical facilities. So that starts next in September, early September. The first team will go over primary care. So we hope to have surgical teams and primary care teams here.
All right, so give me a final thought this morning.
Well, the thing that I think that strikes me the most is how people are so thankful that we just come. You know, when we, even if we don't have anything with us or we don't have enough, they just thank us for being here. It's not real common for outsiders to come into Ukraine like this, or to go towards the Eastern Front where the fighting is going on. So people are just so friendly, and they tell us all the time, please, thank you, America. Thank you, United States, for supporting us. And so we want to continue to do this.
Let Dr. Petty give us the final thought. What would he like folks here in Kansas City to know?
Well, thank you very much. First off, back in Kentucky, I see a lot of Ukrainian flags and banners in people's yards as a sign of solidarity with Ukraine, but so many people do not know how to help. I think you can help through your church. Ask your church how they are helping with Ukraine. I think organizations such as Global Care Force are instrumental. I like to give to organizations that put the majority of the donation toward the people. Global Care Force is one of those. I will attest to that. Secondly, I want to emphasize that the quality of care given by my Ukrainian colleagues is outstanding. And I don't say that lightly. I've seen cases here of extremely complex reconstruction that I believe their job is as good as any care that could be given anywhere in the world. And I have been in some 76 countries. I've traveled a lot. So my hat's off to Dr. Maxime and his colleagues who are doing such a job with a very limited amount of equipment. So if people do want to help in Kansas City around, I would look at maybe finding a way to donate so that some of these supplies could be procured for my colleagues here. The third thing I'd like to say is in deference to your infectious disease consultant, I believe that you probably have a collection of 4 doctors here who will agree, get vaccinated, they work, and they help, and they are effective. We study vaccines, all 4 of us, we believe in them.
We thank you for that. Thank you very much. And I'm going to let Dr. Petty and Dr. Morsch go. One more question for Dr. Maxine. Ari wants to know if the people that you're helping, they're concerned that they're getting access to just regular medication, like diabetes medication or even allergy medication. They're curious.
Thank you for the questions. Yes, in the region was not occupied, and in time when we got the front line near the Kiev, working the all hospital, probably not all, but in some polyclinic work the doctors in each Kiev city department. We got the pharmacy was work and provide, we got the government program for the free medicine for patient. This provides this free medicine for patient and provide another medicine what they need to the patient. For the children, it could be cardiological medicine, diabetes medicine, it's allergy medicine, it's when the patient got the bronchial asthma, we provide all this medicine. But I got the patients not from only from the city Kiev. I got them from all our country. We got a very huge country, like for European-sized country. But I know the patient who stay in the occupation region was the place where it's occupied Russian Federation. They stay without any. Some cases with any medicine like the insulin, and it's very terrible for me when they typing for me and ask how I can help them, how we can treat this, and they say they doesn't get any bandages. I recommended the washing bandages and rebandaging this wound. Is terrible situation. But thank you our people and thank you everybody who donate, who provide any help to Ukrainian in all department where control of Ukrainian government. The all people could get the basic medical help and basic medicine.
I know that you just taking 30 or 40 minutes is a lot out of your day right now. So we want to tell you thank you. Any final thought for the people that are watching, Dr. Maxine?
I want to say thank you very much to each people who help our country, because before of 24th of February, I'm not believing in the war. We living in a normal country, and we think how we can doing what we're doing in the holiday. Maybe somebody want to travel, and after 24th of February, the beginning of the war, we stay think how save our life, how save the life of the patient, how save the life of our families. And thank you very much to all organizations who provide to our country help, to all countries who support our country. And I want to say to making some donates to Global Care Force, because I know this organization and they provide help to place in Ukraine where this needs this help and provide this medicine. Thank you, everybody who help and think about our country. Thank you very much.
Well, thank you so much, doctors, for taking the time. I know you need to get back to it. So with that, I will turn to Dr. Hawkinson. Listening to the stories this morning, it really puts life in perspective. What are your final thoughts after listening?
You know, certainly, just as we had our guests say, you know, continue to endorse vaccination, be up to date with your vaccinations, not only COVID vaccine, but all those other vaccines that we know can help prevent disease and continue to have an impact on people's quality of life. And then second of all, certainly my thoughts and prayers are out with everybody in the Ukraine, the people of Ukraine. Also, thank you so much to Dr. Morshin. All that he does, has done all over the world, just continues to do great work.
That is for sure.
Yeah.
We know a lot of you that are watching right now are going to want to help. So we want to make sure that we are safe and that we are getting our donations to the right place. And so with that, I'm going to invite a retired FBI agent back to our show, Rich Kolko. Thank you and welcome back. You're in sunny Florida. I hope it's sunny.
It is, Jill. Thanks for having me back.
Earlier in the pandemic, you told us to slow down and be sure to verify a charity before giving. Remind us how to do that again.
Well, as we heard all the doctors just say, that it's critical that assistance arrives in Ukraine. And there are many ways to do that. Americans and many other people around the world are giving people and want to do what they can to help. The issue is they've done some research and there are hundreds of fake sites that have popped up listing these donations. That doesn't mean stop donating. That just means you need to do your homework. And that is not that hard to do. The things you got to be careful of are the unsolicited requests, those emails from people you don't know that say, click here to donate. Some of those crowdfunding sources where you don't know where they've come from. The fact of the matter is that we have the infrastructure to help us make those donations. You don't want to rush. You don't want to send cash. You don't want to maybe set up repeated donations until you're sure where this is going. And the best way to do that, just do some research. If you get an email that says, we need a donation to help Ukraine with medical supplies or bulletproof vests or various things, food, you can do that. Instead of clicking on that website, learn what the name is and go into it directly, because one of the most popular things that scammers do is they set up websites that look very similar to the fake websites, and that's how they are able to steal your money.
Well, we know that Global Care Force for sure is a trusted source because we talked to them this morning. They're boots on the ground. They're doing it. But how do you find other trusted sources? Talk to us what you mean by trusted.
Well, there are plenty of organizations that help verify the different donation sites, charity locations. You need to go through them. Basically, it comes down to doing your research. You know, just if you're throwing money in a can, at your religious organization or outside the shopping mall, hoping that's going to Ukraine, it just depends, who's directing that from that point on. So at your church or temple or mosque, wherever you would want to donate, that's fine as long as you know the leaders and what they do, what they're going to do with that money. I've seen police departments collecting money for bulletproof vests. I've seen various organizations putting these up there. But the issue is, and to your question, how do you verify it? You've got to do your homework. There's nothing wrong with using some of the bigger sites that are out there. Check them. These organizations that are donating money, they're doing news stories on this. Make sure you can connect the dots and find that you're not just sending your credit card somewhere and not knowing what's happening with that. And there's nothing wrong with asking. These organizations, they're going to need your donation today, but they're also going to need it tomorrow. So you don't need to feel rushed or pressured to get it in today. And in reality, the valid organizations, they want this to be handled correctly, because if you send your money off and it's scammed and it doesn't make it to Ukraine and help anybody, that hurts the good donation sites as well.
Right. You say you're not a big fan of those crowdfunding charities. Is there any way to click and verify those?
well, I'm scared of that word when you say click, because that's the thing that can often get malware into your computer, into your phone, into whatever device you're using. So if you're getting a link from somebody you don't know, an unsolicited email, something on one of the social media sites you use and you've never used it before, my recommendation is don't click on that link. You can find another way to get there. I've got a website that I've asked them to put up right here. Best way for you to go check it is go to a website similar to this. These organizations are there to verify that the donation sites are valid. And there are very specific ones now for Ukraine because of the enormity of the problem and the situation and the ongoing issues that are there. So there's nothing wrong with just checking any of these websites and using them before you send your money.
All right. It is so good to see you again today, and thank you for hanging with us. Any final thought?
My final thoughts is, my thoughts are with Ukraine, first of all. Second of all, unfortunately, this problem isn't going to end. So if you're going to donate, please make those choices yourself, what's best for you and your family, and then follow along. The issue is, and we can see this already, you're covering it today, but even in the news, it's kind of dropped off a little bit as far as the coverage every single day. But we know that the war is going on full speed every single day. So we can't let the less media mean that they need less donations. So we need to keep up the interest in providing assistance where we can.
Well said. Retired Agent Rich Colco in Fort Myers, Florida, thank you so much. As we sign off this morning, we wanted to share an inspirational photo from one of our loyal viewers back here in Kansas. Rusty Luffel mowed a message in the backyard that reads, "Stand with Ukraine." You can see it high above the sky from his home in Mission Hills. Rusty hopes this will keep the U.S. motivated for helping Ukraine and to let Ukrainians know that Kansans are thinking of them. Thanks for caring and sharing that hard work, Rusty. I'm sure that took a little bit of effort. And thank you for being with us today. Get out and make it a great weekend. We are expecting Jessica Lovell back on Monday morning at 8 a.m.
1,000 young people died of a drug overdose last year alone, according to the CDC. The majority of those deaths due to opioids like fentanyl. I'm Jessica Lovell. Coming up Monday at 8. What can be done to stop this alarming trend?
Subscribe to our morning medical update and open mics with Dr. Stein's podcast. Now, everywhere podcasts are available.